Good afternoon, and thank you for joining us for our weekly update. I'm very pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, and Nancy McDonald-Duncan, our Acting Fire Chief and Director of Emergency Management. I'd like to say a special thank you to Nancy, as this is her last press conference with us. Next week, we'll be welcoming our new incoming Chief, Darren Rizzi. And of course, Sam Rogers, our Mississauga's Director of Enforcement, is here to take your questions, any questions you may have about enforcement afterwards. Sadly, we learned about the death of an employee at Gateway Canada Post facility, and I would like to send my deepest condolences to his families, friends, and co-workers. And before I provide my update, I do want to talk about an issue that came up at my council meeting today: dog walkers and dog groomers. Right now, it's not clear under provincial regulations whether dog walking and pet grooming are currently allowed in Ontario, with municipalities across the province interpreting the regulations differently. That's why Council passed a resolution last week instructing me to send a letter to Ontario's Solicitor General, Sylvia Jones, asking to provide clarity on this issue. And because we know how important dog walkers and dog groomers are to so many of our residents, the letter also asked the province to amend provincial regulations to explicitly permit dog walking and pet grooming as an essential service. Until we get clarity from the province, all enforcement of dog walkers will be suspended in Mississauga, as well as dog grooming businesses, provided that they operate by curbside pickup only. We are beginning to see some promising news in the numbers of new COVID-19 cases in Mississauga, reflecting the overall trend right across the province. Peel Region is now averaging 183 cases per 100,000, down from 247 last week. Mississauga is now averaging 145 cases per 100,000, down from 187 a week ago and over 200 2 weeks ago. I'm very encouraged by this trend. Today we had our lowest daily case increase in well over a month. The reality, however, is that we still have a lot of work to do until we can talk about a broader reopening. What deeply concerns me is the recent arrival of the more transmissible UK variant in Ontario. The large outbreak in a Barrie long-term care home, Roberta Place, has killed 45 people, and it appears to have been caused by the UK strain. So we cannot let our guards down for even a second. We have to do everything we can to prevent that from happening here in Mississauga. That means continuing to listen to the provincial stay-at-home order and leaving home for only the essentials or for exercise. I'm very hopeful that our cases will continue to steadily decline over the coming weeks, and we can begin making a case for safer reopenings and, most importantly, for our schools and for our small businesses. And while the vast majority of residents are playing their part in helping us get there, there are some people who clearly think the rules do not apply to them. Over the past week, enforcement officers issued 38 tickets for people violating the stay-at-home order. Sam Rogers can provide more detail on these charges if there are questions from the media. I was very disappointed to hear about these tickets. So many of you have made enormous sacrifices for the collective good, and we simply won't tolerate those who intentionally and flagrantly break the rules. We have to remember we're still in a very precarious situation, particularly with the threat of a more contagious variant. The situations at our hospitals, while improving, also remains very serious. Trillium Health Partners currently has 75 COVID patients, 13 in the ICU, and another 35 suspected cases. While these numbers are down, they are down for partly because a substantial number of patients have been transferred out of Trillium Health Partners to manage the steady stream of incoming COVID patients. Brampton's William Osler Hospital currently has 87 COVID hospitalizations, 16 patients in the ICU, and another 48 suspected cases. In Peel, there are 23 long-term care homes and 14 retirement homes and 11 group or assisted living facilities that are in active outbreak. The positive news is that our hospital partners and Peel Public Health have now administered almost 28,000 doses of the vaccine to frontline healthcare workers, to essential workers, hospital workers, long-term care residents and their staff, and those living in high-risk retirement homes. They are now busy administering the second dose of the vaccine to these groups. While the rest of us are waiting for the vaccine to become widely available, we all have to continue following the public health guidelines that are part of the province's ongoing response to the pandemic. Sadly, what's missing from that response, despite wide-ranging calls, is paid sick leave for all Ontario workers. And we now have the raw data to show that people are choosing to go to work sick. Research conducted by Dr. Lowe and Peel Public Health from August 2020 to January 2021 shows that close to 2,000 COVID-positive individuals in Peel reported going to work while symptomatic. They went to work with COVID symptoms. This is 25% of the total 7,784 symptomatic cases, almost 8,000, studied during that period. What's even more troubling is that 80 of those individuals, 80 of the 2,000 people went into work after testing positive, knowing that they were carrying the virus. That is pretty compelling evidence and data. If people are forced to choose between losing a paycheck and putting food on the table, they're going to choose the paycheck. The province and the federal government have taken unprecedented actions to limit the spread of COVID-19, but there has been no movement on paid sick leave. In Peel Region alone, there have been 218 workplace outbreaks since the onset of the pandemic. We also know that only 40% of Canadians have access to paid sick leave, and only 10% of low-income, low-wage earners. The lack of paid sick leave is a glaring gap in our COVID-19 response, and it's time that we tackle this issue head-on. Dr. Lowe, as well as other medical officers of health, have been calling for paid sick leave for months. We also have the support of the United Way and the Mississauga Board of Trade. The Canada Recovery Sickness Benefit offered by the Government of Canada is insufficient. First of all, people can only apply after they've become sick with no guarantee of receiving the benefit. Secondly, it's only $450 after tax, which is minimum wage, below minimum wage, and certainly not enough to live on in the GTA. And it makes it impossible to cover rent, put food on the table for so many who survive paycheck to paycheck. And lastly, it doesn't compensate those who only need to take off a day or two to take a test and to await for the results. To qualify for the benefit, you have to lose more than half of your working week to qualify. But it's not just medical officers of health who have been calling for the paid sick leave. Mayors from across Ontario have also been strongly advocating on this issue for months. Ontario's big city mayors passed a motion urging to get this done. GTHA mayors have also been calling for this for weeks and weeks. And as I mentioned, we also have the support of the United Way and many of the boards of trade. I spoke yesterday with the Federal Minister of Health, Patty Hajdu, urging that the federal government make this a priority. And today, I'm again calling on the federal and the provincial governments to take urgent action on paid sick leave. Please step up and make this a guarantee for the duration of the pandemic. A new system needs to be in place so that workers can make the right choice and stay home without losing their wages. We cannot wait for this any longer. It will save lives and help bring the virus under control sooner. It is one of the best investments we can make to help us reopen and begin the long-term economic recovery of the GTA and the entire country. I do want to thank the Premier for urging that the federal government make testing mandatory for all travellers into Canada. The federal government has made it mandatory for travellers to test negative for COVID before they depart for Canada. But we know from the voluntary tests at Pearson Airport that more than 2% of people arriving in Canada are testing positive for COVID. This is something I also raised with Minister Haiju yesterday, because I believe making testing upon arrival mandatory, as the Premier has also asked for, will add an extra layer of community protection, especially at a time when there is heightened concern about more transmissible strains of the virus. The issue of stricter travel measures was discussed on the weekly call with the GTHA mayors on Monday. It was also agreed that stricter travel measures at this time are warranted. There are reports that the federal government will be putting into place more travel restrictions very soon. And it is my hope, along with the other GTHA mayors, that these will include increased quarantine enforcement, including the use of technology, as well as other additional testing measures at the airport to detect the presence of the various viral strains. What's clear is that we haven't come close to exhausting all the tools we have in the fight against COVID-19. And it's incumbent that our government partners take urgent action on paid sick leave and enhanced travel restrictions so that we can keep the community safe and begin the process of recovery. And now, I'd like to invite Dr. Lowe up to give his update, please.
Thank you, Madam Mayor, and good afternoon. Mississauga's test positive for COVID-19 this week currently sits at 7.9%, which is down from 9.2% last week, and the weekly incidence rate sits at 145.0 cases per 100,000, which is down from 187.1 per 100,000 last week. This week commemorates 1 year of emergency response for us at Peel Public Health, the longest such response undertaken by our health unit since the founding of the region of Peel in 1974. With reports of the first case of COVID-19 arriving from Wuhan early in January 2020, Peel Public Health applied the lessons of SARS and entered emergency response together with local public health units across the province. Meticulous case management and contact tracing delayed community spread for nearly 2 months until a flood of cases seeded from the uncontrolled outbreak in the United States pushed us into our first wave. We have since processed nearly 200,000 laboratory results to track trends, traced over 50,000 positive cases, managed thousands of exposures and over 500 outbreaks in workplaces, long-term care homes, and schools, answered almost 100,000 resident calls, and 3,000 requests for enforcement together with our police and bylaw partners who have done even more. And together, we've all learned a lot about COVID-19. We initially employed the lessons of SARS, but certainly recognizing that the lessons of SARS only take you so far when you are dealing with a new entity, quickly learned how COVID-19 is different. We've also seen firsthand the impacts of COVID-19 on our community, our elderly, our first responders, and our essential workers. And on that point, I too, like Mayor Crombie, extend my condolences to those grieving the passing of the Canada Post employee at Gateway facility. We stand with you as we stand with all who have lost loved ones during this disaster. The loss of life is tragic and reminds us of why we all must continue to band together to stop the spread. We've also learned that in limiting contact with individuals outside the home and staying home if sick, contacting public health if you need a safe place to isolate, and if you must be out and about, distancing and masking, especially indoors, those individual actions do make a difference. Of course, not everyone can do this so easily, which is why the places that have seen the greatest success in their battle against COVID-19 have done so by taking care of their most vulnerable. In those places, they pay businesses to do the right thing and stay closed, erasing chances for spread. They take care of their essential workers through providing protections, inspections, and investigations. That support helps many more do their part and stay apart. We are at a pivotal point in our fight against COVID-19, and while trends are cautiously optimistic, the detection of the UK variant in Ontario and other variants in Canada could easily erase the progress that we have made. Spreading more quickly, we must do whatever we can to stop them from getting into vulnerable settings, like our long-term care homes, our schools, and workplaces. Working together, we can bolster our progress while vaccines continue to arrive. Vaccines that have been identified and approved are safe and effective. And once supply issues are resolved, Peel Public Health is ready to make them easily and widely accessible to our community. I also am waiting, but will absolutely roll up my sleeve to get it. But it is not yet my turn. And I ask the same patience for each of you. We would like to be able to move everyone who wants the vaccine to the front of the line, but the supply isn't there, and that means the right thing to do is to ensure that our most vulnerable are prioritized for vaccination. That means until our turn comes, we must do all we can to keep transmission down and stop spread. No travel outside the country. Stay home as much as you can. Meet and work virtually and leave only for the essentials. And for our essential workers who have trouble doing this, more needs to be done for them. Paid sick days, more workplace rapid testing, more workplace inspections, and more protections for temporary and contract workers. All of this towards a simple goal: get COVID down and tame the wave so that when the vaccines come, we can drive coverage up and turn this story around. It's that simple, and it's what we must do together. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe, and now we are all prepared to take questions from the media.
Your first question comes from Christina Tenalia from CP24. Go ahead, Christina.
Hi, Mayor Crombie. Hi, Dr. Lowe. Thank you so much for taking my question. This question is for you both. I'm going to start with Dr. Lowe, though. I know
Certainly.
we asked you this about the situation at Canada Post. Thank you, Mayor Crombie. And you both commented on it. What can you tell us about the death of this worker? Canada Post nor the union can acknowledge that he died due to COVID-19, just that he died and he tested positive. Now, as far as I'm aware from the provincial guidelines, when someone dies and they are positive for COVID-19, it is counted as a COVID-19 death. What do you know based on your investigation so far, Dr. Lowe?
So, Christina, thank you very much for the question. You are correct. That is the provincial definition. Certainly if COVID-19 is identified in an individual who has recently been deceased, it is considered one of potential many antecedent causes of that individual's passing. Our specific investigation into a Canada Post continues, and unfortunately at this time I'm not able to disclose any further details until those are reviewed and finalized. Thanks for the question.
Thank you, Dr. Lowe. Mayor Crombie, actually, my second question is what I'll do is I'll direct it to you both because thank you, I'm satisfied with that, Dr. Lowe. My question for you both is, are you aware of complaints from workers here at the facility about their concerns with health and safety, lack of cleaning? We have spoken to Canada Post, and they say, Dr. Lowe, that they are abiding by the guidelines and the expertise from Peel Public Health. But considering there's some 4,000 plus people that work at this national hub, there have been 241 COVID-19 cases. Are you, Mayor Crombie, or you, Dr. Lowe, concerned about the health and safety of these employees and that all the guidelines are being followed? Thank you.
Peel Public Health's investigation into workplaces occurs in the course of an outbreak when it is identified. The mandate to protect workplace occupational health and safety lies with the Ministry of Labour, and certainly if any employee has concerns, they should call the Stop the Spread business line, which is, I believe it's 1-888-365 quadruple 4, or no, actually, sorry, 1-888-444-3659. That is the Stop the Spread business line to report any concerns that they may have in respect of their workplace. So there is certainly, if there are concerns about occupational health and safety at work, workplaces. This is part of what I have been calling for, which is more proactive inspections on the part of the ministry to get into places before outbreaks occur. Because as you know, my jurisdiction at Peel Public Health starts where an outbreak is identified, but more proactive compliance is managed by the Ministry of Labour. And so I think this is really where we've been trying to say we have data, we know what the high-risk workplaces are. We need to continue, and I know our Ministry of Labour partners have been doing this and should be resourced to continue doing their good work in responding to concerns and complaints in workplaces. Thanks for the question.
Christina, it's Mayor Crombie. Just wanted to say once again my condolences to the family, the friends, and the colleagues. I understand for the individual who has now passed, and of course I have no information about the individual, but my heart goes out to the family. As well, I know that there are 244 individuals who work at the Canada Post Gateway facility that are currently home isolating to be safe, and I would suggest that this is a prime example of where rapid testing can be used, so to actively detect and then isolate these cases. We know that Canada Post and Amazon are using the rapid testing that has now been approved federally, and there are many other organizations seeking to use those as well. I will say that I am grateful that Canada Post employees do receive sick pay benefits, so are able to take the leave and isolate at home and are covered. Thank you.
Your next question comes from Shauna Hunt at City News. Go ahead, Shauna.
Oh, hi there. This question, I guess, is for Dr. Lowe.
Thank you, Shauna. I'll invite him up.
Lowe? Yeah, thank you. Dr. Lowe, I'm wondering if any of the positive swabs that have been taken from the Canada facility are being tested for the UK variant. So I'm just wondering if there's any reason to believe that mutation could be in this outbreak.
Thank you, Shauna, for the question. Yes, we have requested variant testing from Public Health Ontario for swabs taken from the Canada Post outbreak. Thanks for the question.
When will and when would we get results on that?
So yes, thank you very much. This question would be best directed at Public Health Ontario, who oversees the process, but our understanding of the laboratory process is that there is a screening test that is done to identify the deletion. If the deletion is identified, then over the course of 48 to 72 hours, they then sequence it to figure out which variant we may be dealing with. But I would encourage you to confirm that with our provincial partners who oversee testing. Thanks for the question.
Next question.
Next question comes from Stephanie Marotta at the Globe and Mail. Go ahead, Stephanie.
Hi, thank you so much for taking my question. So in the Canada Post outbreak, we've seen that rapid testing helped identify a number of positive cases that otherwise would have made it into the facility. So have any other workplaces in Peel started using rapid testing, and will there be more starting to do rapid testing soon, and how so?
Stephanie, the only other example I'm aware of is the Amazon facility. And as you know, you called me about it earlier, there was an outbreak there as well. And I'm going to ask Dr. Lowe to respond because I believe he's aware of some of the other larger organizations or companies that will be employing the rapid testing.
Yeah, thanks very much for the question, Stephanie. Mayor Crombie is correct. We have employed rapid testing in 3 Amazon workplaces that are in outbreak, specifically in Brampton, Bolton, and at Mill Creek, and in addition to this at the Canada Post facility. I should highlight in mentioning that the facility in Mill Creek has since exited outbreak, to my understanding. But we are very fortunate and grateful that we at Peel Public Health had been pushing for the deployment of rapid testing, and you heard it in my remarks again. We need more rapid testing in these settings to go beyond the initial high-risk exposures in workplaces to really see if there's further spread within these facilities. And I'm hopeful in working with our ministry partners and our Ontario Health partners, our provincial laboratory partners who oversee testing, that we will get more of this facility in the days to come. So thank you very much for the question.
Follow-up?
Thank you for that. My next question is on workplace disclosures, and the province's privacy commissioner said that naming businesses with outbreaks would benefit public health measures during the pandemic. But we've heard from Peel a few times that disclosing workplace outbreaks would discourage businesses from cooperating with inspections and investigations. But if a business doesn't cooperate with a government investigation, isn't that an issue even beyond the pandemic? So in what way would businesses not cooperate with investigations, and what mechanisms does Peel have to ensure that businesses cooperate with these investigations to keep employees safe?
Thank you, Stephanie, for the question. I will ask Dr. Lowe to respond, but it has been our policy that unless they are a front-facing business that interact with the public, that we don't disclose for fear of stigmatizing them and them not cooperating with us. Our goal is to safely isolate all those workers, quarantine them, clean the plant, and ensure that everyone is safe and cared for. So I'll ask Dr. Lowe about the public disclosure and what he feels about the issue. Thank you, Stephanie.
Yes, thank you, Madam Mayor, and thank you, Stephanie, for the question. I'm going to provide two aspects to the answer. First of all, in respect of a disclosure as a whole, Peel Public Health is one of the first health units in the province that basically started disclosing all of our workplace outbreaks, but essentially non-nominal by sector. And certainly in terms of public health measures and informing where risk is, we're able to talk about that. We know that most of our outbreaks are in manufacturing, in warehousing and distribution, and in food processing. We have that all up on our website, in addition to the back rooms of retail and food and beverage, which have all been identified there. And so this is information that actually helps us to be proactive. To the extent that people are focused on workplace disclosure, naming and shaming, as it were, the reality is it's too late for those businesses already. You've already got spread, you've already got an outbreak. What you should be doing is you should be looking at the data and saying, well, clearly we've got a problem in these sectors, and that is why we have made sectoral information available. We've even gone down to the level of workplace by sector and the number of cases, so that you can have an understanding and a piece there. And it allows us to strike that balance between giving information to act on public health measures and also ensuring that we are able to garner employer cooperation. Because ultimately the big thing is we hear, and we've seen in other jurisdictions, as I understand it, where disclosure is starting to happen, they don't want to talk to public health. They may do things to encourage their employees to not speak to public health. We've heard of obstruction that's occurring, and there's also been evidence of it occurring in other jurisdictions where disclosure is taking place. And that puts workers and our community at risk. So ultimately, our goal is to really make sure we're striking this balance between disclosing information that allows us to act proactively, but also ensuring that we can make sure that we get into these workplaces, do our investigations, act quickly. In the case of Canada Post, I can only imagine how much worse that outbreak would have been if we weren't in there from the get-go and able to identify the need for rapid testing, identify the need for some certain shifts to be shut down. So I think I'd highlight that first and foremost. And then secondly, in terms of measures that can be taken in the event of non-cooperation, Peel Public Health was the first health unit in Ontario to actually issue a Section 22 that requires workplaces to comply with our outbreak investigations. So that gives us an additional tool that in the event we're not getting the cooperation that we seek, we can actually levy fines and also direct certain actions to be taken. And of course, this doesn't change the fact that we work very closely with the Ministry of Labour to ensure that proactively we're also into workplaces knowing where the problems are. So I think a lot of people focus on disclosure. The reality is, let's talk about the stuff that's actually going to keep workers safe. Paid sick days, proactive workplace exposures, more rapid testing during outbreaks, inspections, investigations, protections. Thanks very much for the question.
Next question, please.
Your next question comes from Isaac Callan at the Pointer. Go ahead, Isaac.
Welcome, Isaac.
Isaac, I can't seem to unmute you.
I've unmuted myself.
Oh, there he
Does
is.
that work?
Okay, we hear you.
Hi, Matt Crombie.
Hello.
I want to ask you about council, both regional and at the city. Today at the city, there was the conversation about MZOs, and there was that presentation from staff voicing a reasonable amount of opposition, I think, to how the current government is using the MZO strategy. Mm-hmm. Towards the end of that conversation, you said that you wanted to send a letter which staff had suggested to the province, but that if there were situations where council supported an MZO and we all supported that, then you would be in favour of using MZOs in that situation.
Correct.
I just want to ask you to clarify that a little bit, because I think there's a danger of almost wanting to have your cake and eat it. We don't want the province to use MZOs, but if council's in favour, then we will. A lot of the staff discussion today was about the danger of subverting the planning process by issuing these decrees. So can you be clear about what situations you would be supportive of using an MZO in, to be clear as to what is acceptable under council's eyes and what is not for this particular mechanism?
Thank you for the question, Isaac. And yes, clearly we believe that an instrument, a tool like an MZO should be used infrequently and usually for the public good, whereas it's to encourage public housing, affordable housing, or long-term care facilities, whatever it might be. And we have seen some situations where there have been with this government that they have used them in situations other than that. So I think the province is doing the right thing, consulting with different councils to ask us our opinion on the use of them. So generally we do feel that they do subvert the council decisions, but there is a complex issue at the region of Peel that has gone to LPAT and is costing us millions of dollars at the region to sort out, and it would be an ideal situation that council could support the use of an MZO in that situation. So what we are simply saying is that there are some situations where we could support the use of an MZO, and in complex land disputes that is costing the region millions to defend would be one of them, as well as to encourage affordable housing, long-term care facilities, etc. But simply to encourage more residential growth, more residential housing. Well, we here in Mississauga, there is an adequate supply. There are more than 20,000 units in the pipeline. We're just waiting for those permits to be pulled. So we're saying use it infrequently. However, we can see different scenarios where they could be used safely, and we would support.
Follow-up?
Yes, but I'm muted, am I?
No, you're good. We can hear you. Thank you.
Oh, fantastic. Sorry. My follow-up would be on the region then. We've got a preview of what the budget you will be discussing from Thursday looks like. It includes a 5.5% increase on the utility rate, which comes after a 7-ish% increase last year and a projected 7-ish% increase next year. The utility rate, unlike the property tax, is based on usage rather than the value of your property. Renters will often pay the utility rate as well, and it's responsible for an awful lot of infrastructure in the water and the wastewater section. Are you concerned that this more regressive form of payment is being increased significantly above the rate of inflation, while property taxes remain relatively low, and the impact that this could have on low-income residents in Peel region?
So certainly I know that our water rates are some of the lowest in the GTHA, maybe even in the province. I think you're referring to the wastewater, and there is always a reason why they increase at more than a reasonable level or at the rate of inflation, and there's likely an explanation with respect to capital investment, capital expenditure this year and coming years for the reason for the increase. But certainly, as you say, it's not the kind of cost we want to have our local residents shoulder, particularly at this time during a pandemic. I know that the impact of the regional budget will be, I think it was 1.4% to Mississauga, so that's very reasonable, and our own increase will be only 0.9%. So I think the overall increase will be very minimal this year. We have it, our residents close to our hearts, because we know how difficult a year it has been for absolutely everyone, and don't want to see any increase more than what is necessary for debt repayment, interest payment, capital investment, and of course public health investment, which is key, public health investment to continue to battle COVID.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Hi, Mayor Crombie. How are you?
Very well. How about you, Steve? I'm staying healthy. I hope you are too.
Trying to. Just had a question. You've mentioned the report that Public Health had put together, the analysis, as it were, on workers that may have gone to work after a positive COVID test. I'm not sure. I've seen, I believe Mayor Brown talked about it, and I've seen you talk about it. But I'm just curious, is there a formal report that's being issued, and is there a date for that?
So this is a study that Public Health has undertaken, and I will let Dr. Lowe speak to that, whether there will be a public release. Mayor Brown and I have the information. We were likely going to probably write a co-author an op-ed on it, but they looked at 7,874, almost 8,000 symptomatic cases, and what we saw that 25% of them, almost 2,000 individuals, 1,993 workers, continue to go to work, notwithstanding having positive COVID symptoms. So they went to work symptomatic, and worse than that, 80 of those individuals actually had a positive COVID test. So Dr. Lowe, why don't you refer to, and then I think there are some additional recommendations you make in that report, and I'll let you explain to Steve. Thank you, Steve.
Yes, thank you, Madam Mayor, and thanks, Steve, for the question. This was at the request of this was at requested of review on the ministry part in terms of just identifying from our data some data around the nature of workers that may have been working sick. And in the course of our review, we identified that there was nearly 1 in 4 individuals who had reported, who had subsequently tested positive for COVID, so they were in our case database, who had reported going to work for at least 1 or more days while they were symptomatic. And then certainly with the 80 individuals, as Mayor Crombie identified, some people who had tested positive and reported going to work on dates after they had tested positive. So you know there's a presumption that they may have known that they were positive. Is very likely. Presumably, if you're waiting for a test, you're also waiting for when the result will come. And I think I really want to highlight and underline here that this is the essential challenge that we have faced in Peel over the last 8 to 9 weeks. I think if you look at our numbers, we've basically plateaued. We've been pretty much, 500. There was the holiday surge, of course, but between 400 and 500, thanks to the lockdown measures that were brought in November, the red zone, plus the letter of instruction that I issued at the beginning of November, we've basically held level and only have really started to see a decrease now in the midst of this province-wide shutdown. So the question you have to ask yourself is, what is the explanation for that plateau? And once you've taken away all the discretionary contacts, it's clear that all of the essential workers that we still have here are essentially, many of them, facing an impossible choice. Do you show up at work, make sure that you have the ability to keep food on the table and a roof over your heads, or do you do the right thing and self-isolate at home but know that you're not going to be able to pay, not going to get paid, and you're not going to be able to make rent? And so I think that's why this data has been there. It is not to name and blame and shame. I think many people are facing impossible choices, maybe didn't know the better, they thought it was just allergies, whatever the case might be. But the data are pretty stark. There were a number of cases, 1 in 4 of our cases, who had symptoms and were showing up at work sick. Thanks for the question.
My follow-up is actually for you, Dr. Lowe, as well. Thank you for that.
No problem. Go ahead, Steve.
You mentioned earlier that some of the test results from the Canada Post outbreak have been sent for testing for any variants, or maybe specifically the UK variant is what you said. Can you tell us about, has there been other situations that Public Health has specifically requested a variant to be tested? And if so, can you kind of ballpark how many times that's happened to date?
No, Steve. Actually, that's we don't actually have any additional variant investigations that we can disclose at this point in time. Certainly, just given the concern around the variant as well as the rapid spread in that facility, that's why we did move to request that testing. And to some extent, that's also why we did move to disclosure as well. I think one thing I neglected to mention in my answer to Stephanie, I'm not sure if she's still on the line, is we will disclose and name workplaces where a public risk exists. That's always in question. And in this instance, Canada Post had disclosed, but certainly in confirming it, we're highlighting that our concern, at least with the situation there and the investigation that is ongoing, in making sure that we take every step possible to protect our workers and to protect the workers in that facility and to protect our community. So certainly, if there was concerns of other variants spreading, we'd be able to advise. At this point in time, we've only had a handful in our region. I believe it's 2 in the Public Health Ontario report. We know of 3 due to a data discrepancy and entry lag that is occurring. But all of those at this point in time that have been identified to us have a noted travel history or a close contact with someone who had traveled outside of Canada. And certainly, if we see other suspicious instances and circumstances, we'll not hesitate to take immediate and quick action. Thanks for the question.
Next question.
Your final question comes from Jonah Shinuda at Mississauga. Go ahead, Jonah.
Hi, Mayor Crombie. How are you?
Welcome. Welcome. Thank you, Jonah.
Thank you. So you and other mayors have been very vocal advocates for paid sick leave, and I do agree with that. However, with the recent major outbreak at the Canada Post facility in mind, Canada Post actually does offer its employees paid sick leave. So I'm wondering, does the city know what went wrong here, and how can we be assured that paid sick leave would prevent outbreaks like this one from happening?
Well, we have to ensure that the proper protocols are in place at all times, whether you're whenever we're out, or particularly at a workplace. I'm very grateful that Canada Post employees enjoy sick leave, but we do know that there are only about 40% of workers more broadly in Canada that enjoyed paid sick leave, and of those, only 10% are the low-income, low-wage earners. So, Dr. Lowe, I know you have examples from other countries in Germany where paid sick leave has made a huge difference in ensuring that workers stay home and self-quarantine and self-isolating without, so that they have the knowledge that they'll be paid and without fear of reprisal of losing their jobs. And so I'll allow you to respond what other conditions should be in place to ensure that each workplace is safe and the proper precautions are being taken. I assume that comes with rapid testing as well as frequent inspections by Public Health and Ministry of Labour. I'll pass that on to Dr. Lowe now.
Thanks, Mayor Crombie, for the question. I want to be clear that paid sick leave is not a panacea. It's not a silver bullet on its own. It is part of a suite of measures that need to be taken. What we are calling for right now is actually building on an expectation that has already been identified. And as we moved into stage 3 of the province's reopening way back in July 2020, which certainly seems like a lifetime ago, I imagine, to many people, one thing that I remember saying pretty much on rote every single week is, if your workplace is reopening, you must have a workplace safety plan. And certainly businesses, if you don't have a workplace safety plan at this point in the game, there's actually a Section 22 in place, and if we hear from workers and there's an outbreak in the course of our investigations, then there are certainly sanctions that will come down. Workplace safety plan basically looks at things like physical measures, personal protective equipment, flow within the building, capacity limits, staggered shifts, all these kind of things that are designed to limit contact as much as possible between individuals. And I encourage any business or anyone who wants to update or review their workplace safety plan to visit peelregion.ca/coronavirus and follow the business tab to access all the resources on all the other suite of measures that need to keep people healthy. But you've heard from me very clear that in addition to that, in addition to the measures of keeping folks apart at the workplace, we also need inspections, investigations, protections for temporary and contract workers, protections in the form of paid sick days or wage replacement or test isolation, lump sum payments, whatever the case might be, investigations, meaning rapid testing, and then inspections in terms of proactive inspections, because we're out there. We've disclosed all the high-risk sectors. Our data is right there on the website to see. So it really is about continuing our work with the Ministry of Labour and for those people who are in those sectors, for those proprietors in those sectors, to take heed and to make sure that they're actually putting measures in place that protect their workers and community. Thanks for the question.
Follow-up?
Yes, thank you. And I also wanted to ask about grocery stores in Mississauga. So grocery stores operated by Metro, Loblaw, and Sobeys, just to give a few examples, regularly post updates about cases where their employees tested positive for COVID. However, bigger chains in Mississauga, bigger chains in stores that also sell groceries, such as Walmart and Costco, aren't doing that. So I'm just wondering, is the city pushing at all for these chains to also start reporting cases like the smaller chains are and being more transparent about them?
It's a great question, and I'm not sure whether or not they do post them. I'm going to ask Dr. Lowe, and then maybe Sam Rogers wants to give an update on what he's hearing about outbreaks, or if maybe he's looking at me like, no, outbreaks at the big box stores. We hear of them anecdotally, but as you say, they don't report them to us, so I'm unfamiliar. So I'll ask Dr. Lowe if he has any further information, then maybe Sam can comment.
Thank you so much for the question, Jonah. This is actually something that I've been trying to advance a thought on. So there's been a lot of focus on why doesn't public health identify and name workplaces that are an outbreak? I think there's also a question to be asked, certainly if the public wants that information and businesses are an outbreak, the province could very well mandate that businesses are required to actually disclose that information as well. And I think you've seen certain chains that have taken that level of transparency to say, here's the situation and reflecting the community transmission and the picture that we're seeing. And there are others that haven't. And I think, from my perspective, it's almost like you don't go to a doctor to ask what a patient's diagnosis is. If you think that it's something of concern, you actually chat with the patient. You actually try to figure out how you can help them or what the situation might be. So, transparency is something that everyone's pushing for. Again, I think the bigger thing, though, besides all these disclosures or talk of disclosures, that's all post facto. That outbreak has happened. Those workers are already impacted, exposed, potentially suffering from COVID. We need to work more on the stuff that's going to keep them safe. Paid sick days, making sure that we're proactively inspecting the high-risk sectors. And then I don't know if Sam's going to speak to probably compliance, because I think that's those inspections, at least from the public-facing businesses. I know that Peel Public Health has worked very closely with our bylaw and police partners there and with our Ministry of Labour partners in non-public-facing businesses to make sure we're in there and checking on compliance. So, Sam?
Thank you, Dr. Lowe, and thank you, Mayor Crombie, for the opportunity to speak. We all know big box stores have gotten a great deal of attention over the past couple of weeks, and I've been here before providing an update and was very pleased to report that within the City of Mississauga and the region of Peel, compliance from a big box store perspective was incredibly high, and we were not surprised to see that. Certainly we can't take full credit for it, but we know that we have been doing many proactive inspections long before the multi-minister task force came in to inspect big box stores. And we certainly believe that our education and assisted compliance efforts really did result in the very high compliance rate for big box stores. That has not been the area of concern from an enforcement and compliance perspective. Big box stores are following the rules. Businesses in general are following the rules. Where we are, discouraged in this past week's numbers is around private gatherings in both residence and commercial spaces. We issued a total of 47 charges under the stay-at-home order in the past week. Last week we were encouraged, and Mayor Crombie had made comments about that, a total of 14 charges in the first week of the stay-at-home order across businesses and private gatherings. This past week we've seen a big uptick, and our message is really simple. As all officials have said, stay at home, and if you're not sure if you're permitted to or not, call 311. But we are out patrolling. We receive thousands and thousands of complaints. We do investigate, and quite frankly, we're catching the people that continue to violate egregiously in the face of the very clear restrictions at this point. Thanks for the opportunity. I'll hand it back to Mayor Crombie.
Thank you, Sam. Next question.
We have one last question from Khalid Salama from My Second Home TV. Khalid, go ahead.
Welcome,
Thank
Khalid.
you. Mayor, please thank Daniel for me because he accommodated my question, though I forgot to raise my hands. And I know the last question is always mine.
Okay, very good. No problem. Welcome.
Very well. So, again, about the study. 80 workers went to work knowing that they tested positive. And is there any range from recommendation to penalty to fine to anything, knowing that they are putting others in danger?
So I'll ask Dr. Lowe to respond, but from my perspective, Khalid, this is just another more evidence that people choose to go to work because they can't afford to stay home, and it makes a very compelling case for sick pay benefits and sick pay leave. So I'll ask Dr. Lowe if there's any penalties involved with those workers who, he says there's not. There are no penalties. We just hope that they are well and that they didn't infect anyone else.
Very well. So, and the follow-up for both of you. Today there was some news about Pfizer kind of complaining of the proper use in Canada for the syringe and the dosage. And they suggested that we could do better with what we have. What's your take on that, you, Mayor Crombie, and Dr. Lowe?
Well, I'll let Dr. Lowe comment, but are you referring to when the second dosage is being administered?
Yes. But also they said, they implied that we wasted some of our doses, which we had.
Oh, I'm not familiar with that. I'll ask Dr. Lowe to respond, but I think that everyone who has received their first dose, at least here in Ontario, is on track to receive their second dose. Dr. Lowe?
Yes, thanks so much for the question, Khalid. Thank you, Madam Mayor. So I think the story that you're referring to, Khalid, was the question around the minimum spacing between doses, and there was initially some concern that not respecting the minimum spacing might be related to, might jeopardize the supply. I mean, I read the same story that you did in the media. The reality is that the National Advisory Committee of Immunization has come out and has said that second doses can be delayed up to 42 days based on the data that they've received and that were submitted in the course of Pfizer's application. And my understanding is that given the critically limited supply that is here in Ontario, there are continuing conversations to make sure that residents of long-term care homes and high-risk retirement homes receive the protection they need within the parameters that have been set out by the National Advisory Committee on Immunization. So certainly, on the topic of doses as a whole as well, we do know that there is potentially a sixth dose in many Pfizer vials, and I understand from our hospital partners where Pfizer vaccines are being dispensed that they are very good at getting that extra dose out using the equipment that they have, which also bodes well certainly for our campaign when it starts to ramp up. So again, minimum spacing certainly being looked at in the course of critical supplies, and also a recognition that even with critical supplies, we are trying to make use of every last drop of that vaccine here in the region of Peel. Thanks for the question.
Are there any further questions?
That concludes the press conference for today. Thank you, everyone, for joining.
Thank you, everyone.